The big thing that, again, she's learning this week from it, and it's as simple as this: unless you ask them, why didn't you book? Why did you take a free report? Why did you take it? Why did you start with a free discovery? Until you get to the bottom of that, there's no point in having any conversation. Physios are only for new leads from Facebook, newspapers, somebody who's took a back pain report, or left a workshop and didn't book, left a free taster, didn't book. Because you understand that they can have a deeper conversation with them about why they didn't book. The big thing that, again, she's learning this week from it, and it's as simple as this: unless you ask them, why didn't you book? Why did you take a free report? Why did you take it? Why did you start with a free discovery? Until you get to the bottom of that, there's no point in having any conversation. As soon as you ask them, you will get a 20-year history of bullshit that'll come out.
People don't expect you to ask.
They don't. So it's like the success in all of this is really understanding the difference. You might think that they're all 50-year-old male or female patients. Like, you've got no idea what the difference is going on in their brain as to where they think they are and why they think their situation is hopeless or nothing can be done. Somebody somewhere has said something that's just knocked them back or made them think that nothing can be done. And until you ask that, when you sit them on a phone and say, can I just ask a question? You've walked into a physio clinic, or you've landed on a physio clinic's website. You had the option for a free visit, or actually to book an appointment to get this thing sorted, or you took a shitty free report with 7 fucking tips in it. Why? What has gone so drastically wrong in your life that you think that it's the truth, by the way, like, it's the truth. What the fuck has gone on in your life to think that that's what you will settle for? It's the equivalent of going into the dentist, right? Ringing the dentist up and saying, I've got like this most incredible tooth pain that's kept me awake for 3 weeks. And have you got a free report to tell me 7 things that I can do? Like, one better way to brush my teeth, a better way to put some freaking McLeans on instead of like whatever. Like, you just wouldn't do it.
It's right, though, isn't it?
It's the truth, right? And until we accept that and tackle it, we don't get a chance to help people. But that's what's going on. Don't let them for 1 second, oh, I just wanted some. You didn't want free information. Like, and every time somebody says that, picture somebody in a dentist chair with like the option of it. I've got a neat, right, Paul, I've got one hand, I've got a free report, and in the other I've got a drill, a needle, and like a scraper, and I'm like looking down your mouth and I can see where the infection is and I can see where the black stuff is in your tooth. Which one do you want me to do? No, I'll just have the free report for another 3 weeks. Would you do it? Never in a billion years. And more importantly, would the dentist let you do it? Okay, yeah, we'll see you next time. We'll give you a call. No, it's not going to do it. And it's no different here. It's no different in any healthcare setting. It's no different in any business. There's a reason they're not pulling the trigger on whatever it is that they want. And until you ask them, we can't move the conversation forward. So that's what you've got to kind of try to understand. You'll see a name and a date of birth and something on that form, but they are all in different places in their mind as to why and how and what they're going to do next. And until we talk about it, like, what's it like? It's gone like that, isn't it, this week? All it is, does not matter. It doesn't matter whether they're coming for a free taster. Like, why did you take a free taster? You've walked into a physio clinic. Why have you not rang us before? Like, why did you wait to see an advert in a newspaper that said, well, I know why, but until we speak to them about it, they don't know why. Some of them will be like, oh, well, just my doctor told me 25 years ago nothing could be done. Oh, okay. And do you still think nothing could be done? Yep. Well, why did you take a fucking free report? It's a mismatch. What they'll tell you and what they do are 2 completely different things. Because even if they're telling you Oh, I don't think anything can be done. Oh, my doctor just said there's nothing can be done. Oh, okay. Well, you must think something can be done, otherwise you wouldn't fucking ran and took a free report. So it's the confidence that they have in themselves. That still tells you they believe something can be done. Otherwise, you would not have rang this place and took a free report. Now, whether or not then you want to pay thereafter is a different conversation. But until we have that conversation first, we can't have the second one. And I know from history that if you talk to somebody on that level, that talks to them internally and philosophically on those types of problems, you're the first person probably in their life that will ever do it. And people do business with those companies.
That's what I've had a lot of, 9% of them. Either for some reason they think that physio can't help them, or someone somewhere down the line, but when you dig so dig a bit deeper, like they realise, oh, no one actually has, it's just been friends and things like that, and they don't know. And, well, why take a report? If you don't think something can help, you don't want the help, why take a free report? If physio can't help you, why are you wasting time with a report then? You obviously do want.
The brain's an amazing thing. It'll play devil's advocate with you all the time. So like 90% of it, the emotion and the power will be like, my life's hopeless and there's nothing I can do and I'm resigned to back pain for the rest of my life. But then they'll have moments in the day where they'll be like, oh, what if something can be done? And for most people, it's just not strong enough to actually move them to do something about it. So they see this thing called free, and it's like, right, there's no risk here. I can't get banned. I might as well have it. And I might as well see. There's the belief and the opportunity and the possibility. And that's what you have to talk to them about. You must think that something can be done, otherwise you wouldn't have took this information. It's inconceivable to think that you're dealing with adults in their 50s and 60s, right, who think like this. This is what we do. This is what human beings do. And it's inconceivable to think that that database is packed full of people who were sat on their ass and were going to do nothing about back pain or knee pain or neck pain until they saw an ad while they were sipping coffee that said, here's some free information. And that ad blew away everything that a doctor ever told them, blew away everything that a family member ever told them, blew away anything an MRI scan told them, and give them for a moment in their life a tiny bit of possibility or belief in possibility. And that's what you've got to continue. And every time they resist, or every time you have that conversation, think about the dentist analogy. Why? You just wouldn't do this. You just wouldn't do it. I'm in the chair, needle, drill, everything I need to take that tooth out or sort that tooth out. Or I can say, free report with some tips on how to brush your freaking teeth back. Because that's the equivalent. Nobody would do it. So don't let them. So we've got to keep that focus. That's the big thing that I probably need you to understand quick as you come in. It's very easy to think that business is front end related, and we're not. We're a back end company, we're a long game company, because of all of this BS that we have to put up with. This is why businesses do okay and can't get past a certain point or have spikes and then troughs, because they rely upon the phone ringing today. They're relying upon enough people who wake up today with enough pissed off basically that their back pain's bad. We're trying to get them 2 or 3 years before that and get them in a long relationship where we say, hey, we appreciate right now that you took this. We also understand why, because probably people have told you you've been let down or you've had your money ripped off, etc. in the past. But what we'd like to do is show you why we're different and show you why we think we will be able to help you. We're the perfect place to help you. And we're going to accept all the negativity you might have on the first call and the skepticism and the fear and the doubt. But if 2 or 3 calls in, we can break down that and give you a bit more belief. We know you'll end up in there, and if you end up in there, you end up in there, and if you end up in there, you end up out there being a lot more active. Might not be 100%, but if it's 20 or 30%, which is better than what you are right now, I'm happy with that, and that's ultimately what we do as a company, basically. So it's a back-end long game. So think that everybody else today, phone rings, hello, yes, see you tomorrow. We're the opposite. Phone rings, hey, can I have some information? Okay, we've got you in the chair. We've got the free report, we've got the drill in our hand. We just need to know why you don't want us to put it in the mouth. What's going on? And when we break that down, we get customers for life. What were you saying? You had somebody pay 800 quid?
Oh yeah, last night. She was like, I've got my card. I'll get all my calls straight back. And I literally, as soon as, and this was all from a lead, she'd already paid for treatment in advance, this was for orthotics. And literally I rang her at 8 o'clock before I left, and she went, hi Sammy, here's my card number, just...
So 2 weeks ago, probably that lady will have been, hello, who's this? This is what, hello?
Yeah.
Hey, it's Samantha from Paul Gough. Who's this? Why are you calling me? Oh, we're just calling about your bad back. I haven't got a bad back. You have? You took a free report. I didn't. No, you did. You did. How'd you get my number? This is what they do. How'd you get my number? You give it to us. Did I? Yep. Like, you left it on the website. So what's going on with my back? Oh, nothing. Are you sure? Nothing at all. Well, how come you took a free report since? Oh, well, it's, yeah, maybe it's just been a bit achy. So how long's it been going on for? About 20 years. Oh, does it stop you from doing anything? Yeah, I haven't been able to sleep for 10 years. I go home from work most of the time, and like, I can't even push my grandkids in the wheelchair anymore. Oh, right, so there is something going on. Yeah. Well, would you like to come down? And no. Oh, well, come on down, it's free. We'll see if we can help you. Oh, no, come on, honestly, it's free. It's free. Yeah, it's free. Oh, okay, I'll see you there tomorrow. And then 10 days later, there's how much? 1,300 quid in total.
Right.
That's what they do.
Yeah.
This is how ridiculous this world is, and how ridiculous it's getting.
Yeah.
That we have to do that and have that conversation with somebody who 10 days ago, like, couldn't even remember giving us their number, didn't have back pain until we asked them 4 times, and then you find out they're on morphine, they can't sleep, they've never worked, like, they think the situation's hopeless, the doctors like said they need surgery, but that first instance is just let me protect myself from this situation. And then they realise that you're not going to hurt them, you're not going to sell anything to them, you're not going to shaft them in any way like everybody else has done for the last however many years. And 10 days later they walk up with a fucking credit card to give you 1,500 quid. 10 days later. How?
Yeah.
It is just the most, like, on the face of it, it's the most illogical thing you ever think that can happen. But it is so consistent across the board, everywhere in the world. The only thing to accept is that's the way we are. Like, it's not us, it's not you, it's not them, it's just the way we're wired as human beings. Like, we've been doing this for so long, and that is not an atypical situation. Some of them start with like, why you calling me? Stop selling to me. Like, oh, okay. And then like 10 days later, hey, so what do you want for coffee? Like, like, hey, it's nice this place, isn't it? Like, yeah, like. Most people don't know how to act when they're uncomfortable or in a situation that they don't like and they're not quite certain about, because they've had so many bad experiences in the past with people calling them and made so many bad decisions. Their only default answer is to like, who's this? Why call it? And break them down, and they usually, you don't get me wrong, you'll get 2 out of 10 who are just the rudest people on earth, which is cool, like, go somewhere else. But the other 8 are just generally a little bit, I'm not really sure here. And over a couple of calls or a 20-minute phone call, I mean, most of them have rolled over within a week this week, haven't they? Like, it seems to be a lot, because we're getting better at it. The more that you do it and the more direct that we get, the better it is.
Monday, I got in touch with 10 on Monday that I spoke to on the phone. 2 straight away just ruled out. 4 booked, and 4's just call back.
Yeah.
We just need that extra bit of love.
That's about right. I always say 2 out of 10 will be rude, who just, like, are just not interested, they took it because it's free. 3 or 4 are ready because they need more than what we give them, and 3 or 4 you need to play a long game with. And of those 3 or 4, 2 of them won't, 2 will. So if you get 5 out of 10 or 6 out of 10 from people who request information, that's about the going rate. That's a good overview, hopefully, of the whole thing. But I also want to get you on the exit call. I think that's something potentially, because I know you'll be going soon. The exit call, and even a 24-hour phone call after the first session. That's where I really want to get you involved in. So 2 full days where you'd be on the phone and just talking, hey, how did treatment go? Were you happy with your first session? And then at the end, so we have this exit call. So it's like, hey, it's a courtesy call, just make sure everything's fine, were you happy with what we did? And then we talk to them about the other options we've got for, like, Sarah's brilliant at that, and massage plans and the momentum programs, etc. That's where we do it on that exit call. So I wonder if you can maybe go through that with her today.
Yeah.
That's my big thing that I need to go. Right now we've got Sammy and Vicky and Jordan on the front end. If we can get Hazel comfortable with that and in a position where 4 hours a day we can just get her on the phone. Just pick up that phone and get that exit call comfortable with a view to people in upsell. Sure, how we start the call, I'll watch a bit of it. And then look at a concept for a 24-hour call.
Yeah.
And then we can block or stop any potential drop-offs, any I'm not quite sure, blah blah blah, and we get the phone therapist on the phone if we have to re-explain or re-engage. And then you'll hopefully then speak to them at the end. You can say to them, hey, it's great speaking to you, I'll be on the phone at the end of your session, at the end of your treatment, and we'll you can tell me what else you need.
Okay.
That's kind of the thing. So we're trying to keep them involved and engaged for life, basically. It's not just a case of 3 sessions and out the door. We're trying to get them engaged in care plans, make them happy at every stage, check in on it at the end, the exit or the graduation, whatever we want to call it, not necessarily the discharge, to make sure that we over-delivered. Would they then give us a review? So talk about the Facebook and the Googles. We can get that going now, and then a view into potentially a massage pamper program or momentum, because it's all tagged. The physios, if they're doing their job from the forms, you'll see what they were interested in, and we can have that conversation with them about it.